best non-surgical prolapse treatments for women with prolapse that avoid prolapse worsening and help you to avoid prolapse surgery? Hi, my name's Michelle and I'm a physiotherapist, and today I'm guiding you through the two evidence-based methods, and these are the methods that we know work most effectively for avoiding prolapse surgery and preventing your prolapse symptoms getting worse, continue having more children, or you just don't want to undergo the surgery. This is a support pessary device, a typical one. This is called a ring pessary. Now, the way these devices work is that they are inserted into the vagina and they actually support the prolapse tissues. Let's take a look at how they do that. And I just need you to bear with me for a moment. If you imagine this piece of stocking here just as the vagina, when you have a prolapse, the vaginal walls become weak and stretchy and floppy. And that means that various organs such as the bladder or the rectum or even the uterus at the top, so if this is our uterus here at the top and the cervix, can actually start to move down inside the vagina and move right down and even sometimes come out of the vaginal entrance. You'll feel a bulge in that area there. You might find it difficult to insert tampons or difficult with intimacy. So this is one type of prolapse, but you can see how the organs start to fall into the vaginal walls. Now, what can we do then to rectify this situation without needing to go to surgery? The first thing I'd like to talk about is a support pessary. Now, these two options that I'm going to talk about are evidence-based, so I haven't made them up. These have been clearly demonstrated in recent scientific research. This is a support pessary device. It's a ring pessary, and this is one of the most commonly used pessary devices. You can see this ring here, and this ring is used, it's inserted in the vagina, so it's basically twisted and it's pushed up behind the pubic bone inside the body, and it opens up in a ring like this. And I've got one fitted here so you can see. So again, imagining this is our vagina, the floppy vaginal walls. I've put a ring inside, a pessary ring inside here. And you can see what that then does is stretches out the vaginal walls. It's going to make them more rigid. And if we think about back to our prolapse here, it's going to help to stop that pushing down and moving down into the vagina. So this is one of the ways that support pessary devices can actually reduce prolapse symptoms, can help some women avoid prolapse surgery if they want to continue with having children, younger women or mature women who want to avoid prolapse surgery altogether. Some women just use these for exercise. They can be put in and out on a daily basis, or they can be left in for a period of time and checked regularly by your pelvic floor physiotherapist or your gynecologist. Support pessary devices are a really useful device. For too long they've been used just for mature women. They can be used by women of all ages very readily and very safely. Here's another example. This one is a smaller one, and this has got a little diaphragm at the top you can see. So you can see how that would stop the cervix falling down inside the vagina. I think that's quite clear there. So that's a great little device that can be used. On the negative side, they can take a little bit of getting used to. It's a bit of trial and error for some women getting the right size and the right style, because there are a number of styles that can be used. And also too, some women with menopausal changes need to use vaginal estrogen to thicken the vaginal walls so that the pessary device doesn't wear into the vaginal walls. And your gynecologist or your pelvic floor physiotherapist will check this regularly for you and keep an eye on that just in case of wear and tear. So that's the support pessary device. That's the first thing I wanted to mention. The second thing that's been borne out well in the literature is the use of Kegel exercises or pelvic floor exercises to reduce prolapse symptoms. And this is for women with mild to moderate prolapse. So it's not with severe prolapse. So if the prolapse is severe, it's coming out of the vagina. So the pelvic floor exercises won't work as effectively in that condition. But if the prolapse is still contained within the vagina, say it's an anterior vaginal wall prolapse, such as a bladder prolapse, a bowel prolapse, which is sometimes called a posterior vaginal wall prolapse, or even to the uterine prolapse that I showed you before, pelvic floor exercises can reduce symptoms by strengthening underneath the vagina and helping to hold the prolapse tissues up. Now, it's very important that you do the correct number of prolapse exercises, and you can refer to my prolapse exercises book here. I have a full program of prolapse exercises to choose to reduce prolapse symptoms and also to help you avoid that prolapse worsening and prolapse surgery. Also too, there's some other factors that you can address as well, and that's coming up in the next video, so stay with me for those as well. The final thing I want to mention, this is the third and very important finding that's been recently borne out in the literature, that we think that a combination of using a support pessary device as well as doing Kegel exercises can have even a better effect than using one or other alone. So I think you can see there's a number of non-surgical treatment options available to you to avoid prolapse worsening. See your pelvic floor physiotherapist, see your gynecologist. Now coming up next, I've got a video on 4 things you can start to do right now to reduce the risk of your prolapse worsening, and these are really important things you need to know, so stay with me for that. If you've enjoyed the video, please give it a like below, and I'll look forward to seeing you in the next video. Goodbye for now.